We just saw that there is just such a huge opportunity with what's happening in AI today to transform how healthcare is being delivered. We decided to start Synthpop.
How did all those experiences kind of shape the way you think about solving problems in, healthcare?
One of the first things I learned, when you're trying to build something big and audacious, is sometimes you need to bring people together. You need to have people who have strong opinions, know how to do things a certain way. You need to make them work together.
Your vision is to make healthcare more human. Is it actually possible? Explain that vision to us.
AI can do 100% of the tasks. We can, at some cases, depending on what task we need to do, we can do 80% of the tasks. That's a huge ROI for our customers, but they still need an amazing staff to deal with those extra complex cases sometimes. A similar shift is going on right now where work is moving. Like we had data move from paper-based. Now work is moving and reasoning is moving. Being able to trust this new software, this new paradigm, this new value proposition is taking time and it needs to be done in the right way.
All right, we are live on the #1 DME podcast, Claim to Fame. Elad Ferber, welcome to the show.
Hey, thanks for having me, Alex.
Welcome.
Awesome. Yeah, thanks for coming. So Elad, for anyone who doesn't really know who you are, I always, like to ask our guests a little bit of background on who you are, a little bit about your company as well. We'd love to hear that before we get started on anything.
Yeah, of course. So Elad Ferber, I'm the CEO of Synthpop, and I'm an engineer by training. Started in the aerospace world, where I built actually also, we're dealing with autonomy today. We're going to talk about what that means, but I've been doing autonomy in the aerospace field, autonomous control systems and drones for a long time, for 9 years before I decided to switch careers into healthcare. Then I started a medical device company and ran it for 8 years before we sold it. And then I was a vice president at a company, eventually called Zoll Medical, Anidamar Medical, where we delivered sleep diagnostics and a few other products. And I learned so much through this period. And essentially, one of the biggest insights I found is that the administrative burden in healthcare is just insane. And so my co-founder, Jan, and I, we were faced with this problem. We just saw that there is just such a huge opportunity with what's happening in AI today to transform how healthcare is being delivered. So we decided to start Synthpop, and together with Jan, starting Synthpop a little over 2 years ago, so we're not that old, we had a vision to start a company that is really based on being AI native and being able to deliver a lot of the value that's behind this new technology to healthcare organizations. I'll talk more about that, but that's essentially what we do. I know you've had on your podcast a few folks who are using, AI and other technologies to help DME providers across the board. We can talk about what makes us a little different, but essentially,
Sure.
We're here to alleviate a lot of the administrative burden that specifically DME, but I think everywhere in healthcare, is very pervasive. So,
Absolutely. Is it okay if we title this one From Drones to DME?
yeah, I love it. Yeah.
And maybe what separates you apart is you've launched a lunar lander,
Yeah.
co-founded multiple startups, and now you're reinventing healthcare workflows with AI. But before we get deeper into all the great things Synthpop is doing, take me back to kind of what first started your love for building.
Yeah, no, I loved building stuff from ever since I was a kid, building, things with my dad in the garage and back in Israel. And even when I was building drones, I always had some project on the side where I was to build like autonomous computer vision systems and things like that. And so I was very, I would say, machine learning native, like from a very young age especially in my career. And that's true also for Jan. Actually, my co-founder Jan is even more impressive, background where he started some of the biggest like music platforms online.
What?
And like Jan sold his first company to Napster. He was part of that acquisition and joined the Napster team, he's got crazy stories to tell about this time. And actually, we have two folks who worked for Napster at the time, actually working for us as were really some of the key architects of the distributed systems and on the internet, so the first distributed systems.
I guess that's what ties in, like you have like a playlist and music on your website. So maybe that background in music kind of ties into your branding a little bit in Synthpop, is that right?
Exactly. So Jan and I are big music geeks. We love music, and we like synthpop as well, which is not it's pretty esoteric these days. It was big in the 80s. But another kind of pun on synthpop is synthetic populations of patients, which we, initially when we started the company, we really believe that it is very like critical to, if you have AI, you want to test it out on synthetic data and synthetic populations of patients to make sure what you're doing works. And that's actually the other part of the name. It's kind of the music genre, but it's also around this like synthetic populations.
Okay. You studied at Stanford and other very notable places, and you've even led engineering at Space.il and helped launch Israel's first lunar lander. How did all those experiences kind of shape the way you think about solving problems in, healthcare?
So I think one of the first things I learned, when you're trying to build something big on audacious like landing on the moon, is sometimes you need to bring people together, and you need to have people who have strong opinions and know how to do things a certain way. You need to make them work together. And I think that's maybe my superpower. I'm definitely not the best engineer in my team. I'm not the best salesperson in my team. I'm not the best solutions architect in my team. But I hope at least I can bring people together. And I think that doesn't just show or kind of signify what we've built at Synthpop from a team perspective, but I think it also actually really ties to what sets us apart from the market perspective, because we see the organizations we work with as partners. We come in, and what we found was actually kind of interesting. The relationship and the work doesn't end, which it sounds kind of bad when you think about it initially, because what's going on? Like, what, you can't deliver? No, actually, we can deliver. The customer needs more. The customer sees what you can deliver, and they need actually for you to stay. And sometimes, actually most times, they don't have the IT resources and the internal resources to keep orchestrating, to keep implementing new AI solutions across the patient journey. And so what we found is that by bringing our team and the customer's team together and being very open to that, we're able to develop those already multi-year relationships with customers, delivering more and more and more value over time. So I think that's really kind of what, drove the beginning of my career, is that capability. And I think now I'm harnessing it in a different way, just trying to kind of bring AI to healthcare providers that could be actually quite complex, with different people, different opinions, different executives we deal with. We come, with our own solutions, and there's third parties. Sometimes it's Nico, sometimes it's someone else. And, being able to bridge it all together to something the customer can actually use and get value from, that's pretty hard. I would say it's a similar level of complexity to landing a lunar lander sometimes, because it's just like dealing with people is actually much harder.
Yep. Something you said I thought was really interesting, and I was actually reading about this the other day. So, similar to humans in AI, they need constant training, right? The model, you don't just do it once and the problem solved, to your point. It's something that's on an ongoing basis. But the difference is, you can train one AI model, you can train hundreds of thousands of people over and over again, so that the notion that you just build it and that's the end of it. I don't think people understand that it's a constantly ongoing thing, but the impact that you're able to have versus throwing bodies at it is huge. And you said that, Synthpop doesn't just automate, it adapts. What does that actually look like in practice, whether it's training the model or continuing to roll out new and innovative solutions for your clients?
Right. So I think we are of the notion that we want to serve our customers across a very broad range of use cases. So, there are some AI vendors out there that do specialize in patient intake and referral intake. There's some that do, a patient calls, call center and things like that. And there's some that do revenue cycle specialized software and AI. We actually believe that by doing a lot of these building blocks, actually, as many of these building blocks as possible, we can provide not only greater value, we are unlocking the ability to orchestrate those workflows. So that's why, I was saying, we start normally with one use case. We start with the biggest need of the organization. In DME, referrals, yes, it's huge. Data, all this unstructured facts data that everybody's talking about, that's a big problem. There's a few others that are, really pervasive, maybe later in the patient journey as well, that we deal with today. For example, all the patient interaction and billing and payer interactions, we have conversational agents that take care of that. So whatever organization we come to, we can start with a place where we can deliver value within 30 to 60 days. And so that's very big, very important for us. We want to make sure we start in a place where we can demonstrate for almost every customer. We kind of do it in 3 steps. First, let us shadow your team. Let us show you that we can actually follow the same workflow, that we understand the workflow, understand what the ins and outs, and our algorithms or our agents can actually deliver validated similar and you can actually use. That's the first kind of like the proof is on us. Then we're starting to be kind of almost like an assist mode that is kind of trust but verify. And that goes on for also, several weeks. And after that, we essentially empower the executives we work with, for our customers to come to their management and with evidence and show them, hey, this is working. We need to use this. And eventually what happens is the organizations we work with are relying on us. And now they're saying, okay, take the steering wheel. This is working. This is stable. We've tried this for, now like 60 days or 90 days. This is working well. Take the wheel. You're good. And that's where we're seeing kind of the ROI really explode for a lot of our customers when you get to that level of automation. But that's generally how we work with clients. And again, we start with one place. And then what happens time and again is that customers, ask us to do more. And that's why we really decided to kind of differentiate ourselves a little bit from everyone else, saying, no, we're not going to do like this piece of the puzzle, for example, referrals. We're not going to specialize in referrals and do referrals for everyone across the board. No, we can do that, but we also want to do more things for you. And you know what? We have some clients that use other AI vendors on the referral side. We do other stuff for them in the revenue cycle. That's perfectly fine with us, and we meet our customers where they are. I think that's a strength we bring. On the flip side, right, this model is not as cookie cutter and scalable as if you were doing just one thing. And so that's where the relationship aspect comes into play. When we take on a customer, we stand up a team that works in front of them. And that's kind of a little different from, how our normal software vendor works. But I don't think it's different from how Nico works. Like when you take on a customer, it's a relationship. It's not just one sale and you're done. You're supporting them through implementation. You configure their entities. You configure their workflows. Yep. You help them if they need it, and it's not ending because you are also evolving. The technology is evolving. And so that's our commitment as well. So I see ourselves actually very much like a partner, just like you are.
Yep. Yeah, I always say there's the software and then there's the ongoing service that comes along with it. It's definitely not, you just set it and forget it. Healthcare changes, other partners like yourself continue to involve and help solve other issues, and we help connect the dots. And I was just thinking about kind of what you said about tackling the referral problem. I think that's like the most obvious, and correct me if I'm wrong. Would you say that's the most broken workflow? Or is there one that's behind the scenes that providers might not be thinking about, or one that would surprise people? Curious of your thoughts on kind of, like you said, you guys are tackling a lot of different problems and it kind of starts small and spreads and there's more you guys can offer, but curious kind of your thought on that.
Right. I think the landscape is changing so quickly. It's hard to tell whether the referrals problem is going to be the biggest one moving forward, because we're already seeing there's a lot of solutions. There's like a plethora of solutions there. There's some, software ERPs that offer their own solutions. There's like AI companies, and you can kind of choose, have your choose of pick of 3 or 4 of them. And so maybe, they as the landscape changes, problem shifts along the revenue cycle as well. And the value for our customers shifts along the revenue cycle. There's also new models like CMS is now going to start doing like prior authorization and things like that. All of a sudden, like the ground is shifting under everyone. And so what's nice to me about our model is that we have a composable infrastructure. If your need today as organization A or organization B is actually most acute here, we can actually probably meet you where you are. But I would say the payer issues are huge. Like and again, Medicare is going to become more complicated, not less complicated, right? With all the shifts that we're seeing. And even commercial payers, it doesn't seem like things are simpler there. a lot of our clients still have very long base sales outstanding and in time until they get reimbursement, and we help close that gap on the revenue cycle side. So I think that's also a very big need in the industry.
Elad, you mentioned meeting the customer where they are, and
Yeah.
I think it's an interesting approach that, it doesn't have to be all or nothing, right? There's a lot of good vendors out there, and there's, different tools for different use cases. So if someone's using someone else, you guys can come in and, help them in a different area, right? And, we're a firm believer of, building this kind of ecosystem of third-party players. Is that, does that set you guys apart? Is that kind of the norm? We believe the same thing, saying, hey, Nico Health does a ton, but we have an open API where, Synthpop is incredible at X, Y, and Z, and we help the flow of communication and the flow of data. Any thoughts on that?
Yeah, absolutely. Look, I think Nico, what you guys represent in the industry, you kind of like the basis. You're the lifeblood. You're kind of the body on which everything works, right? And I think I told you before we started the podcast, some of our largest clients operate on Nico, and like the volume of transactions we have with your API is just staggering, and it just works, right? Now that enables both of us to do really interesting things. Like Nico is definitely benefiting because customers know that, hey, I can use APIs with Nico. I can actually do things on top of the data that I'm generating every day with my hard work. That's so important and so valuable for customers. And we can come and say, you know what? We can connect to that layer and we can do work. We can actually perform work and actions on it that can drive value for you and can release your employees and your staff to do things that are much higher value for the organization than things like data entry. Things like staying on the line with a payer for an hour and a half until they pick up and then asking them if someone is eligible for a service and what the copay is. Like, we can do that for you. And so I think that's where, I think it's an amazing, like, symbiotic relationship we have with Nico and also some other partners that we have to be able to deliver that. We're doing the agentic orchestration layer. We can, call a payer, figure out eligibility and benefits on the phone for those cases that you can't do it via API or portal or whatnot. We come back, and then from that orchestration layer, we write directly back to Nico, and we can say what the results were. So it all stays there, right? And so I think that flexibility on your layer, or flexibility on our layer, it's really what makes this magic work.
Yeah, we actually, right before this call, we just hosted an hour-long webinar all about the API. I think over 450 people subscribed, and it's just kind of, which to me is amazing, right? And these are all different companies of shapes and sizes. Like, for example, a couple years ago, you only really heard of, larger enterprises that had these type of capabilities or even the know-how to leverage them. But now I'm definitely seeing it trickle down to, mom and pops and the long tail of DME asking for these types of things, exploring it. And, we're really trying to spread the word to future-proof your business because, the legacy way of doing this is you have like a single stack where all the data is just in your system and that's the end of it. And that's really not, it's the total opposite of the way things are going. So the title of it was Future Proof Your Business. And I think that just plays nicely to what you said, being able to have, let's say, layer one, and you guys are layer two to actually take action on all that data instead of it just being siloed.
Right. I think the customer being able to harness their own data, that's incredible. And there's some places where that's much harder to do. And so I really believe, that's a huge service that, Nico and other platforms that are also open for, for this are doing to their customers. But definitely, Nico, I think, stands out in the crowd for that.
Elad, I want to ask you, we've had a handful of different guests on the show, right? So we've had a bunch of different AI players in the DME space come on. We've had, Tenor, we've had Notable Systems, Compliant RX. And I always like to give everyone the opportunity to kind of, come to this stage and say, why Synthpop? What sets you guys apart?
Yeah. So I think what sets us apart is, when we come to a customer, we stand up a team. We have a very experienced solutions engineer, that has built in DME before and has, much more experience than I have, in this realm. You have a project manager. You have, at many cases, actually, we stand up an engineering team that is working with you. And because we know that it doesn't it's not just a software delivery problem. It is about mapping your workflows, understanding, you could have two customers on Nico or on other platform. They can have very, very different workflows. They have very different product portfolios, very different priorities, and very different problems that might be solving. So we know that it requires that level of engagement to go out of that, hey, let's test AI and see if it's working, if this thing is working at all, to let's actually drive value for our organization. I've listened to some of the folks you mentioned, on the podcast, as I was kind of preparing for this, but and I think they actually say a similar message in a sense, but I think what sets us apart is just the level of how much we leaned into that. When I said earlier, the relationship continues, it doesn't end. I wasn't kidding. We're continuing, and the more time goes by with clients want us to bring even more resources to help them get more things automated and more workflows done. So I think that's where there is a huge need, I would say, across the board in this. I wouldn't call it a service layer, but it is essentially a service layer. Like, you need to help an organization make this change work.
Yep. Yeah, you're, a long-term strategic partner outside of just the technology. With that being said, your vision is to make healthcare more human, right? And all this can feel sometimes cold and technical just because of the nature of the beast. Is it actually possible? Explain that vision to us.
Yeah. Well, if we are able to release some of the workforce in our customers' base to do things that are much higher value. So, AI can do 100% of the tasks. We can, at some cases, depending on what task we need to do, we can do 80% of the tasks. That's a huge ROI for our customers, but they still need an amazing staff to deal with those extra complex cases sometimes. Being able to serve those patients faster, like just by implementing us, right? Those 80% of the cases that AI can take off your plate, those patients are being served instantly almost. That's incredible. It's such a huge difference to the experience. And then those 20% that used to wait for weeks or months in queues until they will be dealt with, now they have immediately workforce that is able to deal with them and solve their problems and help them, right? So yes, we're dealing with a lot of automation. We're taking work away, but we're actually freeing up space. We're making space for what really matters, and we're delivering a better patient experience. That's the ultimate goal of our work, and actually for our customers too. That's where we align so much. It's like, how can you make the patient get care faster and better care?
Yeah, it's easy to kind of just look at the data and the numbers and how to make processes better, but it always comes back to the patient and how to, improve that experience for them. And as healthcare it's one of the hardest spaces. It's slow, it's cautious, it's highly regulated. What's been kind of like the biggest challenge that you've been seeing when you're building Synthpop?
I think trust is really big. How do you trust an automated, almost like alien system to do work that you've trained people on and that you had folks, do manually and exercise judgment, for years, and is the lifeblood of your business? Like, you're really like putting a lot of folks really are putting their career at stake, making this bit. We are, and we know our customers are if they really buy into this, like, because they need this to work. If you now rely on an AI-based solution for, let's say patient intake, right? That's, if that, is not working for some reason, your business is not working. So I think being able to provide a robust solution, but not only from the technical side, being able to work with organizations to make that shift, that's one of the biggest challenges for every organization to do. But I think, it's probably similar to what organizations experienced when they moved from paper-based to digital, right, in healthcare. And that actually didn't happen that long ago. It's wild to think about, but it didn't happen that long ago. And so a similar shift is going on right now where work is moving. Like, we had data move from paper-based. Now work is moving and reasoning is moving. And so being able to trust this new software, this new paradigm, this new value proposition is taking time, and it needs to be done in the right way. And that's what we've learned. And that's why we need to be there, because sometimes we get calls, 7:30 a.m. Pacific Eastern, and kind of we need to wake everyone up and, hey guys, we need to do something because that's the lifeblood of our customers, and we are there. And so I think that's kind of like that support system you need to provide when you're dealing with such a critical system, and that's not obvious. Because the AI can look like a game, or like a chatbot,
Yeah.
or like a Clippy assistant or something like that, but this is much more. It's
Yeah.
actually doing work.
Yeah. And to your point, AI can feel like a black box. How do you actually build that trust, or go down that path to saying, hey, this is not a video game. This can change everything, over time.
I think there has to be a lot of awareness of what it can do well and what it can't do well. And so that really happens in that first part of our implementation. I call it like shadowing the real work, where you have a workflow, wherever it is in the revenue cycle or the patient journey. We go and we shadow that. And you compare our performance to the existing performance or historical performance of the team. And then you see kind of, where does the AI fall a little short? Where does the AI perform really well? I mean, you know what? That gives executives a very clear picture of what's happening and where they can trust it on a consistent basis, and where, there's some cases where we actually rather have, a different workflow. Because it's not about, yes, there's what the technology can do and can't do, but it is how you wrap it in a workflow that is foolproof and actually delivers value. That's the core of deploying this.
It's kind of like crossing the chasm, right? Like there's going to be like the early adopters, and it's going to become more mainstream over time, and we're kind of phasing through that, and it's happening pretty quick. But there's still a lot of people that are probably a little hesitant to trust AI, since it's such a big buzzword right now, and not everyone knows exactly what that really means.
Right, absolutely. And there's a lot of organizations that were burned by it. I think Trey talked about it from Tenor talked about it when he was on the podcast. Like, there was kind of like initial infatuation with AI, but there's very quickly a reckoning that it has drawbacks. It's not perfect. It can't do everything. It actually has some gaps in reasoning sometimes. And so what we found is really about, I still believe it's an incredible technology. I think we all are. It's about wrapping it in the right guardrails, in the right workflows that deliver value consistently. That's essentially how you can harness it today and deliver real ROI.
Sure.
If Synthpop succeeds in everything you imagine, what does healthcare look like in your mind in 5 to 10 years?
So I think, we already operate across multiple specialties. So we are big in DME. We serve some of the largest, and actually mostly very large DME providers today. We also serve the largest fertility, chain in the country, and, some of the largest diagnostic testing facility groups in the country. I believe that patients across the board will see much faster care. All of a sudden, things will feel instantaneous. Like you're being referred to one of our clients, which actually, because we deal with some of the largest clients in the country, we're going to deal with you, and we're going to, review a record and run your eligibility if it's very complex with a payer, and, automatically qualify you for service and things like that. But as soon as you're referred, you get, a text to your phone or even a phone call and saying, hey, welcome to, let's say, MedBridge Healthcare, one of our clients. We just reviewed your file, and it's a minute after you got referred. You're all clear to go. We need you to sign a few forms. We sent you a link. Let's schedule you for a sleep test or for an appointment. That's that easy, and you completely collapse this entire administrative process of, now we need to read the file. We need to assign them to the right lab. We need to get, somebody needs to call the patient at some time and ask them if they agree to, to give their credit confirmation. All this stuff, there's like so much, and we can collapse it immediately. And so patient care is going to be better. It's going to be much more efficient across the board in all those outpatient specialties that we serve. But yeah, that's yeah, and we're working
Yeah,
towards that. Well, I think that
I was just
yeah.
taking in everything you said. Yeah, it's going to be an exciting next few years for sure. And I was just thinking, when we were doing a little bit of research on you before we do this, like we do everyone, you've worked with a lot of CEOs, and CTOs on a lot of the stuff that we talked about, like leadership, hiring, regulatory changes that we've talked a lot about.
Yeah.
What are some words of wisdom for people listening to this that might be building something on their own, or they might own a DME, and there's so much overlap when you're building, whether it is you're a provider, whether you are a payer or a vendor, or next gen solution like both of our companies. Any words of wisdom to share with our followers just in general?
Yeah, I think it's to a lot of followers. I know there's a lot of people listening who are building DME businesses, and our
Hmm.
Nico customers. Some of them are Synthpop customers, some of them are not. And I think being able to harness this technology for what it can do today, that's really critical. Can't expect it to solve everything, but it can solve some things for you, and those things can be very meaningful. And so leaning into that is big. And for folks who are building technology in healthcare, there's a lot to be done. Healthcare is broken in many, many, like 1,000 ways. But I think what we found is that leaning in to some to areas where there's like unexpected gaps. For example, one thing that wasn't obvious that we found is that actually big enterprise healthcare clients need a partner. Yes, it's hard to sell to them. Of course, it's hard. It's hard for them to implement technology. Imagine the burden on an IT division of like a large national provider. They have a million tasks and they're understaffed. If you're going to deliver a solution for them, you need to be able to do it in a way that they can ingest and they can actually receive. And to us, leaning into that and doubling down on that point, being a partner and delivering and standing up, to do what's right for them is what was not obvious, and I think positioned us very well.
Right on. Well, Elad, I think we can move on to our rapid fires. It's usually how we end up concluding the rapid fires. Wayne, did you say you want to do some rapid fires today? You want to give it a shot?
That's all you.
All right. All right, cool. Sort of like a this or that. We can just jump right into it. Let me know when you're ready.
Yeah.
Okay. Space mission or healthcare mission?
Space mission or what?
Or healthcare mission?
Healthcare mission, hands down.
Okay. Move fast and break things, or move carefully and earn trust?
So I think move carefully and earn trust, especially since we're in such a rapid moving like industry and such a rapidly moving technology. Like every day there's a new AI capability. We need to make sure we deploy it carefully.
Right on. AI doing admin work or AI helping with clinical decisions?
Admin work, hands down. My previous company was doing AI doing clinical, and it was very important, but a much longer pathway. Much,
Sure.
much longer.
Mentor 10 founders or raise $10 million tomorrow?
Mentor 10 founders. $10 million will come.
Startup chaos or corporate stability?
Startup chaos every day.
I have a special one here. Live concert tomorrow, Taylor Swift or Omar Adam?
Oh my God. That's a hard decision, but Omer Adam. Yeah, Omer Adam is
For
the
sure.
bomb, man. So,
Last one, rocket science or data science?
data science. Yeah,
Right
rocket
on.
science is a division. All sciences are a division of data science, in my view. So,
I can see that. It makes sense. It's a little bit above my pay grade, but I believe you there. If anyone wants to reach out to you or find out more about Synthpop or anything you do, how can they reach out to you and contact
yeah,
you?
it's easy. DM me on LinkedIn or send an email to elad@synthpop.ai. I'm here.
Perfect. Well, this was awesome. We had a really good time with you today. Learned a lot about the AI space, and hopefully we could do this again sometime soon.
Absolutely, Alex, Wayne, thank you so much.
Absolutely.
Pleasure as always.
Appreciate your time.
Take care.